One. Okay, so hey guys, let me share my screen. And we are moving on to chapter 47 in fundamentals. And this is data collection in client care. So let's rock and roll. All right. So, what is data collection? It's collecting data, collecting information about the client's condition, doing a physical, and then identifying and clarifying what is their health status, right? Do they have any health problems? What's their general state of health? Do they have any specific risk factors or anything that looks out of the ordinary, right? You always have to consider their understanding of the healthcare system and their ability to cooperate, their cultural background, all those things, their age, their developmental status, all those things play a role in whether the patient will be, you know, amenable or accepting of whatever testing or anything that has to be done for them. Okay. And we also have to understand the difference between normal diagnostics and abnormal diagnostics, right? So when we assess, we use something called cold spa. When somebody has a complaint of something, we say, okay, what's the character of it? What are your signs and symptoms? When did it start? Where is it? Like if it's pain, how long does it last? Does it recur? What is the severity of it? How bad is it on a scale of 0 to 10? Not 1 to 10, 0 to 10. What makes it better? What makes it worse? And any associated or precipitating factors. In other words, when did it start? Did something happen? So your hip hurts. Well, when did it start hurting? Oh, when you fell. So there you go. So that's the precipitating event. Okay, make sure you know this. All right. Medical diagnosis. We do not diagnose. We're not permitted. Only nurse practitioners and physicians can diagnose. Okay. That's identifying specifically what's wrong with the patient. But our job is to gather the data so that the doctors or the nurse practitioners or the PAs can come up with a diagnosis, right? That is our job as nurses. We collect the data, right? All right. We do a history, and I'm going to go through what a history and physical looks like. Okay. And we'll talk about care plans another time. Here is a page dedicated to therapeutic communication techniques, right? Active listening. Just lean in, listen to what they're saying. Open-ended questions so that they have to answer you with sentences, clarification, questioning them. Tell me more. What else happened? Back channeling, like using active phrases like tell me more to show that you're interested, but don't worry about calling it back channeling. We're just going to go with restating, right? Probing, close-ended questions. Make sure you know close and open-ended questions. Close-ended questions are good if you just need a yes or no answer. It's also great if somebody's having difficulty speaking, right? And summarizing. So summarize. So here's what I heard you tell me. And then you go on and kind of repeat it back. Okay. Here is the way a health history should go. What's the information you need? You need their name, address, and contact information, phone number, birth date and age, their gender, their race. Are they married, single, divorced, widowed? What do they do for a living? Are they working? What's their insurance? Emergency contact. Where do they live? Do they live with family or other people in the home? Do they have advanced directives? And then source of history. Who is giving you the history? Is it the patient, or if the patient maybe has dementia, is it a family member? So is it reliable? Is it accurate? Then you want to know, what is their chief concern or their chief complaint? Ask them, what brings you here today? And then let them give you a history of that chief complaint or that present illness. What happened? When did it start? And all those questions, right? Concomitant manifestations, in other words, other signs and symptoms that went along with when this thing started. Okay. Then you want their past health history. You want to know, did they have any childhood illnesses, right? Anything communicable, anything chronic? You want their whole medical, surgical, obstetrical, gynecological, psychiatric history, right? You want their immunization status, any screening tests. Maybe they had a PPD done. When was it? What were the results? Any allergies to anything, medication, environment, or food. You want to know every med they stick in their mouth, over the counters, If they don't tell you, I say to people, do you ever take Tylenol or Advil or anything like that? Any herbals? You need to know everything, even vitamins. What are their habits and lifestyle patterns? It matters, right? Their interests, social activities. Are they isolated, right? Or do they have a nice, healthy kind of a psychosocial lifestyle? Do they abuse substances, alcohol, caffeine, tobacco, recreational drugs? And yes, you do kind of have to come right out and ask them. Family history, very important, right? Their immediate family, first degree family members. So their parents and grandparents, any brothers or sisters, and children or grandchildren. You want to know, what is their support system? Do they have one? And then if they have immediate family members that have passed, when did they die? How old were they? And what killed them? Psychosocial history, like I said, relationships, support systems, any concerns about finances or spiritual concerns. All of this goes into a history, a health history. And then do they exercise? So that's why their job is important. Do they sit most of the time? Do they move around? Do they belong to a gym? Do they get any kind of exercise? Do they understand what the risk factors are for things like heart disease or cancer, diabetes, stroke? And then do they expose themselves to dangerous substances like the sun? Everybody except me, just so you know, I am exempt. Um, there are different factors that influence the data collection. Sometimes cultural factors. Remember to be culturally empathetic. Um, try to make sure that you're talking to the patient at their level. Okay. And then know the risk factors for disease so you can explain it. The modifiable risk factors, which we've gone over ad nauseum, and the non-modifiable. You can't change your age, can't change your genetics, and you can't change your race. You can change your diet, your exercise, your weight, smoking, excessive use of alcohol, smoking a crack pipe, all those things. You want to kind of stay away from those. And then the course of the disease. Diseases can be acute or chronic. Acute is something that comes on quick and is over relatively quickly, days or weeks. Chronic is going to be lingering around for a long time, months, years, even the rest of your life. When we talk about acuity, that means how severe is whatever they have, right? Complications, right? Any complications? Did they get an infection after they had a fall and cut their leg, right? That's a complication. And then diseases can be primary or secondary. So you can have primary hypertension, which is you have high blood pressure, or you can have secondary hypertension that results from or is the sequela of things like kidney disease, right? So understand that. And then know the difference between signs and symptoms. Signs are things that are objective. You can see them, you can measure them. Symptoms are things the client's going to tell you. They're subjective. I'm up all night long. I can't breathe when I lie flat. Blah, 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 blah. Okay. And here's a little tip. Signs, objective. A sign is an object and a symptom is subjective. This is something from the book. Use it if you like. I'm not a big fan. Um, Common signs and symptoms can be anything from anorexia, which is loss of appetite, to a cough, to cyanosis, diarrhea, dyspnea, edema, emesis, which is vomiting, fatigue, hemorrhage, jaundice, malaise. Oh, I just don't feel like doing anything at all. Pale, pyrexia, fever, right? Inflammation. When something gets inflamed, that's a response to an injury. Okay, that's your body's mechanism of trying to fix whatever happened. You can have acute or chronic inflammation. Acute inflammation is usually the equivalent of infection. Think about it. You will see purulent exudate, which is pus, but we don't say pus because we're nurses, right? Purulent exudate is usually acute inflammation. And chronic inflammation, again, that's something that lasts a long, long time. Things like arthritis, right? Chronic inflammation. And then infection is invasion by a pathogen. We talked about that a little bit already. Something got in that wasn't supposed to get in, a bacterium, a spore, a mold, a fungus, a virus, right? That can cause some kind of a problem. Okay. We're going to do a separate one on pain, right? Because pain requires a whole PowerPoint of its own. But pain is protective. In other words, when something hurts, your body's saying, hey, don't hurt this anymore. Okay. And we will go over in that one the pain reporting scales, because there's the Flack scale, the numerical scale, and the Wong-Baker-Faces scale. Question. All right. We're not going to do this because we're not at that point of infection yet. So I'm just going to get rid of that. All right. Here are diagnostic tests. I don't expect you to know all of these or even some of them at this point. They're here FYI reason, but as we go through the body systems, then we're going to talk about the tests. Now, we already know with respiratory, we talked about pulse oximetry, right? We know about that, pulse ox. We know about a chest radiograph, which is an X-ray, just a fancy name for an X-ray, okay? And we know about ABGs, so we can highlight those. We will go through all of these diagnostic tests as we go through the body systems, okay? So there's a whole bunch of them, okay? We did already talk about informed consent. It's required, not for, well, for some procedures, I'm going to say, not most, right? And you know that with informed consent, when you're witnessing it, the only thing you're witnessing is the patient's being awake, alert, and oriented, not under duress. So they're not being forced to sign it. They're not medicated or cognitively impaired in any way, shape, or form. You're witnessing that informed consent. That is all you're witnessing. You are not witnessing whether the surgeon explained everything to them. Okay. And if the patient has questions after they sign informed consent, you say, let me get the doctor. Right? Okay. And those are board questions. The physical examination, we're going to go through this briefly. This is the head to toe, and you'll learn how to do a head to toe pretty quickly. Remember this: look, listen, feel. Okay. You always look, you observe and inspect before you auscultate, before you palpate. Most often you won't percuss. So you see, I did not have that highlighted. Okay. A student nurse can use percussion to collect data. No, that percussion requires a lot of experience. We don't percuss. Well, you don't percuss. Here are some tools, okay? Gloves, pen light, right? It's a tuning fork, cotton tipped applicator, tongue depressor, cotton ball, stethoscope, otoscope, and data collection. This is going to go through how you do a head to toe. You start examining that patient the minute you walk in and look at them, because you're looking at their expression, their posture, their gait, their movement, how they look. Is their height and weight kind of in correlation with each other? Are they well groomed? Are they sloppy? Are they dressed inappropriately? Get their vital signs, right? And then head to toe, just like it implies, you're starting at the head and you're going down the neck, the chest, the breast, the abdomen, the arms, the legs, the back, and the perineum. Genitals are last. Okay. And we will do this in lab this week. Okay. I want to go through a head to toe assessment. You're looking at the skin. You're looking for erythema, cyanosis, or jaundice. You're looking at the skin also for macules, papules, vesicles, pustules, fissures, ulcers, nodules. And I'm going to call this last one a lesion, not a tumor. Any lesions, okay? And we'll learn what all those things mean, okay? What is their skin temperature? What is the skin turgor? And remember, you check for tenting at the right below the clavicle. You check for skin tenting right below the clavicle, not on the hand, all right? When you do look at their hands, you're checking cap refill on their nails, and you're looking at their head. Is it normocephalic? In other words, does it look like uneven? Do they have a steel plate in their head? How does their hair look? Does it look healthy? Does it look thinning? Are they losing their hair? Is it dry? All these things matter, right? And then, observing their face and head for symmetry. Can they respond to commands? Okay, or can they respond to questions? That tells you what their level of consciousness is. When you're looking at their eyes, report of normal findings is expressed. Okay, so let's change this. Gotta love this book. Okay, when you're checking their eyes, remember we talked about Perla. Perla, Perrla, is pupils equal, round, and reactive. Oops. Reactive to light and accommodation. Okay, that's the way you would document it, and we will go over the assessment for that. You're looking at their arms, their joints, their muscles, their body movement. Do they have full range of motion, right? How is the strength on one arm versus the other, or one leg versus the other? Can they stand up easily, or do they take a long time? Do they need the table to get up? Or the furniture surfing or wall surfing? When you get to their chest, you're looking at their chest, you're observing their respiratory movements, you're listening to their lungs, their heart, you're counting the pulse rate and the respiratory rate. Okay. Observation of the breasts. Have they had surgery? Right. Bowel sounds, super important. And we're going to go over that in lab too. You must listen to bowel sounds in all 4 quadrants of the abdomen. And you must listen up to 5 minutes per quad. Up to 5 minutes per quad. Okay. Because if you don't hear sounds, it's an emergency. That's a life or death situation. Okay. Is the following statement true or false? Observation is one of the most important aspects of nursing. It's very important. I don't know if I'd call it the most important, but it's definitely important. And that is it for this one. So that was a lot of information. I'm going to stop the share and I'm going to stop the recording, and you know where to get me for questions. And so that is it. Peace.